Welcome to De-Stress Chiropractic. This is a chiropractic teaching video. In this video, we're going to go over my patient who's suffering from low back pain. I'm going to look at adjusting his occiput. Then I'm going to adjust his left TMJ. Finally, we're going to look at his feet and the impact of these joints. And lastly, I'll adjust his low back. Let's get into this case study. Here I'm testing the muscles. The muscles in red are the muscles we're testing, and red indicates that they are failing. This is the glute med muscles. So what our patient here is showing is all lower extremity weakness. First, I'm going to go mobilize C1 and see what it does to his leg strength. It does not make any changes. Next, I'm going to go look at C7 and simulate what would happen if I adjusted it. It has no impact. Finally, I'm going to go look at his occiput, and that's his skull on his head. And that fires up his leg muscles. So that tells me that's the segment I'm going to adjust.
Bring that left ear to your left shoulder.
After his treatment, I'll get him off the table, have him stretch, and just to see what impact it has on his low back. And then I'm going to go back and recheck his muscle strength. Interestingly enough, all the muscles that were previously strong are now inhibited. I'm going to gap his jaw and see if it has an impact on his muscle strength, and it does. Here I'm checking to see if it's the right side. The right side does not make a change, but the left side does. So it's the left side that I will be treating. After the adjustment, I'll go back and do some trigger point work of the muscles of mastication in the oral cavity. Before he gets off the table, I want to check his feet. And one of the ways in which we can do that is by striking the bottom of the feet and going back and rechecking some muscle strength. In this case, it causes inhibition of his muscles. One of the things that we may forget is that we take 10,000 steps per day. If we're having issues in our feet, the proprioceptive signals from our feet will fire into our brain, our nervous system, and the brain's output will be abnormal. The adjustment you saw me perform was that adjustment between the metatarsals and the tarsals, there at number 2, and also we're going to look at adjusting the 5th metatarsal from the side. This is important for any patient that has any type of problem, really. So there's the top and there's the side, and we'll take a look at that from another angle. This is just a general kind of adjustment. We will recheck striking to see what impact it has on the foot. And here we have strength. This is normal. This is appropriate. Once again, I'll have the patient walk, see how his low back feels. And he keeps feeling better and better and better.
Drop those arms. Look up. Now we'll walk.
How's that? Now bend.
Okay, let's do one last thing on your stomach.
And then finally, when it's all over, I will actually adjust his low back. This is important for patients with chronic low back pain, that there can be other factors having an impact upon the low back pain. It may not be low back issues specifically. I hope this video has value for those of you who are my fellow chiropractors in looking at a global perspective of treating patients.